preparing for this discussion, came across a topic that was a little under the radar screen from my background, and that has to do with understanding how some of the common medications that our patients are on can sometimes be affected by the extreme heat and how that medication is occurring in that patient. So can you comment a little bit on that?
Yeah, I mean, I feel like we're probably only going to be able to scratch the surface because there are just so many medication considerations when it comes to heat. And I guess for the sake of simplicity or to kind of create a little bit of organization around this, I kind of mentally like to put these issues into two categories. The first category is medications that make the body more vulnerable in the heat. And then the second category is medications that pose like logistical challenges to the heat. And so for that first category, things that increase vulnerability, we actually want to think about both prescription medications as well as over-the-counter medications that can impair the way that a body is able to tolerate heat or regulate its temperature, because we know that that can predispose people to actual heat-related illness. And so, as we've already went over, sweating is a very important part of thermoregulation. It's what allows evaporative cooling to happen. But some medications actually decrease the ability for somebody to sweat, making it harder for them to cool down. So that includes things like antihistamines. Diphenhydramine is going to be an example of that. Some mental health medications like amitriptyline, and even some like blood pressure medications like clonidine can decrease the ability for somebody to sweat. I want to make note of another blood pressure medication or a class of medications, beta blockers, and so metoprolol, as well as some decongestants like pseudoephedrine. Those medications actually don't allow for as much vasodilation, or doesn't allow for the blood vessels to kind of expand their size. And this vasodilation is really important for thermoregulation. And so if somebody's on beta blockers or some classes of decongestants, it also can make it hard for them to keep cool. There's other meds that can cause imbalances in electrolytes and the fluid status, as well as lead to some dehydration, which is not going to be beneficial in hot weather. So this includes some diuretics that might be used for high blood pressure, or maybe even like laxatives that might be used for GI symptoms. When somebody's dehydrated, they can have decreased blood flow to their kidneys. And so that can actually lead to kidney injury in the heat, especially if they take over-the-counter non-steroidal anti-inflammatory medications, or NSAIDs, like ibuprofen. Also, dehydration can make the relative concentration of some medications higher in the bloodstream, making them supratherapeutic or being above the therapeutic range. And that can actually lead to some adverse effects. There's also some medications that can actually directly increase an individual's body temperature. So we think about stimulant medications, and so like methylphenidate, which is used for ADHD or attention deficit hyperactivity disorder. Other antipsychotic medications used for mental health conditions can also raise the body temps. And a very common medication people are on, levothyroxine, which can be used for hypothyroidism or an underactive thyroid. That can also directly increase the body's temperature. And I know we're not really talking about like skin effects of the heat or the sun, but commonly we hear about like doxycycline, an antibiotic, or like topical retinoids. They lower the threshold for people to have redness of their skin due to UV exposure or sunburn. But there's actually some other surprising medications that do the same thing. So, for example, a very common diuretic, furosemide or Lasix, that actually can do the same thing and make people more susceptible to sunburn. So that was that first category of medications that kind of like make you more susceptible to heat. Did anything surprise you before we go to our second category?
No, that's great comprehensive study there.
Yeah, so that second category is meds that kind of pose logistical challenges when it's hot outside. And when we think about this, you have to understand that, and you understand, but everyone should understand that appropriate storage of medications on hot days especially is going to be important because heat exposure can compromise medications or the delivery devices that they use to get those medications into a human's body properly. One example that I believe that you're aware of is that in temperatures above 120 degrees Fahrenheit, which, I mean, my car's parked in an outdoor lot right now in Durham, North Carolina. I'm sure the inside of my car is greater than 120 degrees right now. But metered dose inhalers, or MDIs, those can actually burst when they get above 120 degrees Fahrenheit. EpiPens, these may malfunction or maybe even deliver not the right amount of epinephrine when they're exposed to heat. Insulin used for diabetes. This should be stored in a refrigerator. The vial should be stored in a refrigerator if it's an unopened vial, and then it should be stored at a room temperature if it's opened. It actually may become less effective and lose its strength if it's left in the heat. So if it's like not in the refrigerator when it's closed, or once it's open, if it's in very high temperatures. And on the note of refrigeration, it's not specifically about a medication, but we should think about things like rolling blackouts. These are occurrences that can happen due to increased energy demands on electrical grids during heat waves. So individuals who have medications who require refrigeration, or maybe medications that require electricity, like somebody who uses a nebulizer that needs to be plugged into like an electric source, or maybe even people who have medical devices like a CPAP for sleep apnea, or maybe they have like an LVAD, for significant cardiac disease that has to be charged. People who rely on electricity for their medications or their medical devices really do need to be mindful and plan ahead for a backup plan in case of heat-related rolling blackouts.